In this video, we're going to talk about outcome surveillance systems. In the last video, we talked about policy surveillance systems, the ability to detect changes in policies over time. Well, that's actually a relatively new phenomenon. The more traditional surveillance systems, at least going back to when surveillance first started being done, really focused at outcomes and risk factors for disease, not just addiction-related diseases, but diseases overall. So there's a couple terms to be familiar with before thinking about how to use these types of surveillance systems. First is the idea of an active surveillance. Active surveillance occurs when some staff member on your team, someone who's paid, an employee, goes out into the field to collect information. Either they go personally or they're contacting people in the field to identify areas of disease, cases of disease, risk factors for disease. This can be contacting healthcare providers. This can be contacting general members of the public. But the idea is the same, is that you're actually paying someone to go out and find this information. This is the opposite of a passive surveillance system where information is provided to you. You don't actually, you pay to analyze the data and extract information from the data, but you're actually not spending any money on collecting the data themselves. The data is collected by someone else and then is supplied to you. The easiest example are with reportable infectious diseases here in the United States. Healthcare providers are required by law to report any cases of certain types of infectious diseases to state and local health departments. All passive surveillance systems work under that same premise. Either a healthcare provider or someone else in the field who's not being paid by the health systems are giving information to a local, state, or national health department. There's a couple other types of surveillance systems that can be used that can be either active or passive. They're not mutually exclusive from the previous two designations, but they're implemented when resources are scarce. So the first is syndromic surveillance, and this is collecting information on a disease using the symptoms of the disease rather than the disease itself. Again, often used in infectious diseases, can be used in addiction science as well if the criteria are set up for it. So you're looking for, take alcohol for example, you're looking for symptoms of drunkenness, but you're not actually measuring how much people drank or doing blood alcohol concentration levels. That would be a syndromic surveillance system where you identify symptoms of the disease rather than the disease itself. And you're making the assumption that the changes in the rate of the symptoms will mirror changes in the rate of the disease, even if they're not exactly, like the gross numbers aren't exact. There's also sentinel surveillance. This will also be used when resources are scarce, which is far too often. And this is when you identify a limited number of sources who will report on the disease. So typically you'll identify large population areas. Particularly in the developing world, you'll focus on state capitals and other large cities, identify the large healthcare systems within those cities, and only take information from those sources. And here you're making the assumption that any change in disease, any change in the prevalence of risk factors in these large sources will mirror changes in the larger population. So you have active surveillance systems, you have passive surveillance systems, and then when resources are scarce, you can implement syndromic or sentinel surveillance. And syndromic or sentinel surveillance can be either active or passive. It can be either one. Those are the classic types of surveillance systems, and we use them often in addiction science. We particularly use active surveillance systems through things like the National Survey of Drug Use and Health, Monitoring the Future, National Health Interview Survey, NHANES, others. Those are active surveillance systems. We take random samples of the population and we get them to answer our questions. National systems such as the National Health Ambulatory, I think it's medical system, where they're actually getting information from hospitals and emergency departments. Those are national passive surveillance systems that we can use to identify cases of things like overdose and other procedures that are done on the patients that are brought in. But again, those are the classic types of surveillance systems. We use them often. We use the NISDA, monitoring the future, and that data very often in a lot of different studies. And we use active and passive both kind of interchangeably, and we want them to kind of tell us the same story. But there are novel surveillance systems which are worth mentioning. And these are things such as using Google search results and seeing if people are searching for types of information together. Not only the number of search results for a specific keyword, but what else are they combining it with? So if you think of polysubstance use, are people just searching for tobacco? Are they just searching for marijuana? Or are they searching for marijuana and tobacco together to see how it can be used at the same time to get the different fix? Are they searching different substances to see if they can counteract each other or support each other and give you a bigger high than you could with each individual substance alone? And you can use the search results, and again, it works the same way. If you see changes in the search results, you can kind of assume that there are changes in the actual population in terms of what substances and what any polysubstance use is being done at the moment in the population. You can also use social media. Now, the benefit of social media is that many social media users geotag their results, meaning that you know their physical location when they actually posted their information. So if they posted about substance use, alcohol, tobacco, marijuana, opioids, cocaine, in certain locations, and there seems to be a concentration of those types of posts and those types of message in a location, that may be where the greatest need lies. So first I want to give you a non-addiction example of how this might work. This is a study that was published from Brazil, Sao Paulo, Brazil, and they're interested in dengue fever, which is spread by mosquitoes. Again, this is not an addiction example, but it's a good example for how geotagging tweets on Twitter can actually help us identify sources of disease. So what they did, they basically wanted to validate Twitter as a tool to track epidemics of disease. So they identified all the geotagged tweets mentioning dengue fever or symptoms of dengue fever in Sao Paulo, and they got it to the point where they could identify the specific neighborhoods within the city that these tweets came from. So they actually had the latitude and longitudinal coordinates of these tweets, which is really kind of cool. They then cross-referenced that with the number of cases per community, per neighborhood of the city, and then compared the two. And just by looking at the maps, you can see that in the lower right corner, where you have the darker colors for the dengue tweets, that matches the darker colors for the number of dengue cases. There were many more cases than there were tweets, but they follow the similar pattern. And that's the whole point, is you want to have a validated system, you want them to follow a pattern. Now for an addiction example. So Lamy et al. In 2016, they published a study. They were looking at who's talking about marijuana the most. So they found geotagged tweets by state, and then they cross-referenced that with state marijuana regulation. Again, this was 2016, so their newer recreational marijuana laws weren't included. But there does seem to be a correlation between recreational marijuana use, states near recreational marijuana use, and geotagged tweets on marijuana. So in the left part of the map, the western part of the United States, you have legalized marijuana in states like Colorado, Oregon, and Washington, where they had the highest prevalence, the highest percentage of geotagged tweets about marijuana. You have very low prevalence of geotagged tweets on marijuana in states that don't have marijuana laws, that don't have recreational marijuanas, that don't have medical marijuana laws, such as states in the Deep South like Alabama, Mississippi, and Arkansas. So the correlation isn't very necessarily the strongest. It has other factors that play into it, but this is an example that you can actually use social media as a different surveillance tool and potentially even a quicker, cheaper surveillance tool than the traditional active or passive systems.